Hearing loss in adults is quite common, and it's believed probably 10% of adults suffer with some form of hearing loss. Hearing loss can be conductive, which is due to infections usually involving the ear, or it could be sensorineural or permanent, which could be due to the effect of noise, medication, and commonly age-related hearing loss. Now, sensorineural hearing loss is irreversible, it's permanent, and that's why it's so important to pick it up early. What may you find? Are you asking people to repeat themselves? Is the television up loud? Do you have difficulty hearing on the telephone? Is it possible that you're having difficulty understanding what is being said, particularly in noisy environments or when there are crowds or multiple people talking to you? Do you feel stressed? Do you feel a burden when you're trying to understand what is being said? These all might be signs of hearing impairment which you have not picked up. If you have any of these, then you really need to see your audiologist.
Hearing is an important sense. It's a great sense for communication and social well-being. If hearing loss starts, it starts so slowly and gently that one doesn't even realizes that it is happening to that person, unless happening suddenly. And when it progresses, our whole brain starts adapting to other senses. The other senses take over. And it is a very, very gradual process. The brain, the neural network in the brain is adapting and realigning. And there can be some serious consequences to hearing loss in adults. They can be isolated, they can be suffering from anxiety, social isolation, depression, mental well-being can be affected, and there can be a serious cognitive decline. There are literatures that proves it. So it's very important that we pick up hearing loss in adults as soon as possible and treat them. Hearing loss can be various types, degrees, and patterns. It is important, almost very important, to assess hearing loss by a battery of tests and never standalone test. Because every test tells different information that we need, and it's like a jigsaw puzzle. Only if we do all the test batteries, we can mix it and understand and interpret hearing loss. So hearing loss should always be assessed by a battery of tests and never by a single test.
You just heard that there are various causes of hearing loss, and the audiologist is going to tell us about the nature and the severity of hearing loss. Teamwork and good interaction between the ENT surgeon, the audiologist, and the other members of the team is so critical to ensure that you get the best right line of treatment, because hearing loss could be conductive due to infections which may need medical treatment or surgical options to reconstruct the eardrum or the hearing bones. But hearing loss could also be permanent sensorineural due to deterioration of the inner ear, the cochlea. Now, in that type of situation, we may have to look at the option of a hearing device. So again, we interact with our audiologist and we help the adult choose the right type of hearing aid or hearing device for himself or herself. Having said that, there are a large number of adults who do not benefit from hearing aid. Are you aware that adults too can get a lot of benefit from cochlear implants? So those adults who do not get benefit from hearing aids, and our audiologist tells us that they're not getting the best quality of sound, might be candidate for a cochlear implant. In which case, through the help of the cochlear implant, this adult may be able to hear almost normal and lead a normal life and carry out work as per usual. It's extremely critical that there is an experienced team of clinicians, audiologists, therapists, ENT doctors and surgeons who will work together to ensure that you get the best type and nature of treatment for your hearing loss.